Don't just guess at hip tightness. The Thomas test can tell you exactly which muscles are the ones with the issue. My name is Beth, and I am with Cantado Wellness, and it is Technique Tuesday. So here we go with the Thomas test. Do you feel confident in assessing which muscles are causing hip tightness? The Thomas test can tell you pretty easily which ones you need to address. So, what we're going to do is have our client bring their knee up to their chest and hold it. And you'll notice what happened immediately is that her leg kind of came up off the table. That means that the iliopsoas has tension in it, and that's where we want to release. Now, she also turned out a bit laterally, which means we should address the lateral hip flexors as well. Had she turned her knee in, then that would be an indication that it's the adductors that had some tension. Now, the other thing that you could check for psoas would be whether her lordotic curve became um, more intense. And so if you can put your arm up under her, and I can't, so we may think that it's a little bit further down and more in iliacus or iliacus than it is in the psoas. But this test will give you a good indication of what muscles you want to address for a client with hip tightness. You can go ahead and put your leg down. It's a great test to use. Let me know in the comments if you've ever used it before on your clients. I hope you have a great day. Thanks for watching.